Today we're going to be discussing Williams Flexion Exercises, stretching of the legs, and some core strengthening. So the first thing that we're going to start with is what's called a single knee to chest stretch. What you're going to do is bring a knee up to your chest. With your hands, I want you to grab behind your knee, so we're not grabbing on the front of the knee to prevent any injuries. And you're going to pull your knee up to your chest till you feel a good stretch in the back of the hip and in the lower back. This stretch should be held for 20 to 30 seconds. You could do it 2 to 3 times a day. It'll be done on both sides of the body. You always want to keep these stretches in the pain-free range too. If you're experiencing pain with this, bring the stretch down just a little bit more. So single knee to chest, you could do it on both sides. The next one is called double knee to chest. So what the patient's going to do is bring both knees up to their chest, again grabbing behind the knee to prevent any knee injuries. And you're just going to pull your knees to your chest till you feel that strong stretch in the glutes and in your low back. Hold it for 30 seconds, and we can repeat this 3 times. That's double knee to chest. The next stretch in the Williams Flexion line is what's called a piriformis stretch. There's 2 ways to do this stretch. The first way is the easier way. You're going to bring the knee up, reach over with your opposite hand, and pull the leg across the body. You want to be at about 90 degrees of hip flexion and pull it across. You should feel a stretching sensation in the side of your hip. This, like the other stretches, you're going to hold for 20 to 30 seconds, and you're going to repeat it on both sides. Good. The more advanced piriformis stretch, bring both your knees up. You're going to place one ankle on your knee, and you're going to grab the leg that's still down on the table and pull it to your chest. So this will be actually stretching the right side. The leg that's crossed on the knee is the side that's being stretched. This is a little more advanced, so if you have trouble reaching this, I would go to the first stretch that we did. Or you could use a towel under your knee to help pull up. Again, holding for 20 to 30 seconds and try to keep it in the pain-free range. Feel okay?
Yes,
good.
Keep breathing.
And keep breathing, definitely. Those are the stretches. The next ones we're going to get into are the core exercises. So the first one that we're going to talk about is a posterior tilt, or a posterior pelvic tilt. What you're going to have the patient do is be in the same position. What they're trying to do is flatten their back down into the table by squeezing their core muscles. So what you're going to instruct them to do is try to tilt your hips back and rock them backwards. Good. If the patient has difficulty doing this, what you could do is tell them to slide their hand, please, under their back and try to flatten their back into their hand. That gives them a little bit of feedback. So you can hold this for 5, 10, up to 30 seconds. Good. And these can be done anywhere. You don't have to be laying down. You could be sitting in a chair. You could be, in your car. You could do them at lights. Hold them back for 30 seconds and hold. You could also go into that posterior pelvic tilt and do little pulses. Those will activate different muscle fibers. Good. Does that feel okay?
It feels wonderful.
Good. So right now she's demonstrating the pulses. The last exercise that we're going to do is called a crunch. We're going to try to do this in the safe range. So what I'm going to instruct the patient to do is do your posterior tilt like we just went over, and then I'm going to have you place your hands behind your head, being careful not to pull on your neck, and I just want you to try to roll your body up till your shoulder blades are off, and that's it. So what we're doing is keeping that back flat and just rolling up. A lot of people think that they have to curl all the way up. We don't need to go that far. We just need to hold that tilt and come up till your shoulder blades are off and back down. If you find that you're getting any type of neck pain or you feel yourself pulling, what you could do is cross your arms across, or they could even be down on the table. The same rules. You're just curling up like that and then back down. You could do 10 to 15 of these, 3 sets, 2 to 3 times a day. Very good.
Playing with Nick. Nick Player, thank you.